My name is Dorothy Leone-Glasser, and I'm the Executive Director of Advocates for Responsible Care.
Awesome. And can you tell us a little bit about the purpose of Advocates for Responsible Care?
We are a nonprofit in Georgia, and we really work to be able to give patients a voice so that they have full access to the medications and the treatments that they need.
Gotcha. And what brings you to the Capitol today specifically?
Today we came to the Capitol to talk about a way of looking at gun violence prevention that we have not considered before.
What would be necessarily your definition of gun violence?
Gun violence is any violence that happens with a firearm that either injures or causes death to a person.
You know, from a shot we did last week, we're kind of doing a little series with the whole Second Amendment. We're kind of taking many different aspects of the story, trying to be informative. And last week we had a shoot in studio where we had some guns, and we were just for our story and our B-roll and everything. And
I was just telling him as an editor, like, it kept looking really violent and aggressive, and I kept telling James, like, hey, is there any way to tone it down? Like, this is really aggressive looking. Mm-hmm. And he looked at our audio manager and was just kind of like, I don't know if we actually can. So the nature of guns itself sometimes seems violent, even though, say, for example, it's been used in, like, actual defense or any sort of better, I guess, what we could maybe call positive use of the gun, that it may still come off as violent, even though it result in an injury or death. Would you still consider that to be gun violence?
The violence is not just around the gun. The violence is around the intention. You know, as a nurse practitioner and clinician, you know, we have to study all of the aspects of what causes harm in so many devastating ways to people and to their communities. So our main focus is that not addressing gun violence in Georgia is hurting our communities. And it's hurting them on a physical, on an emotional, on a social, and on an economic level. And that's really what our focus is how do we start having that conversation around gun violence.
And that's kind of what it seems like with the shoot, is it's like with some of the shots, we just wanted regular shots just for the story, and it came across as just inevitably kind of violent like that. And it's like, and it's like, with that being said, it seems like it's even hard to start the conversation about it if you can't, cover it properly. And also, I wanted to get into, you had talked about a lot about ARC deals, or one of their big things is there's not really much gun violence research in Georgia. That's just what I wanted you to talk a little bit about that.
Yeah, the Georgia Coalition for Safe Communities is really looking at what is the data that we have that's particular to Georgia. The CDC and the NIH were just given $5 million to now go back to examining gun violence research. And we're happy about that, but it doesn't tell us anything about what's happening in our communities in Georgia. And that's what we're interested in. So we feel very strongly that if we don't have the exact data, how can we possibly come up with any strategies?
What kind of data are you looking for?
We're looking for how this affects the individual that is either a victim of the gun violence or families and communities, and following it all the way through. When you come into an emergency room from a gunshot wound, it's not just what happens in the emergency room. The effect of that gunshot will last sometimes for years, certainly for months. So if you carry the trail into their psychological, physical, community, societal, and economic outcomes from a gunshot wound, we need to be looking at that. What is this costing our state in all of those areas? So we're looking at the state using a public health framework to examine gun violence in Georgia and to be able to collect the data that is necessary to understand for children, for instance. So we have 7 children die every day from a gunshot wound. We need to be looking at the impact of this on our children. We were recently in an interfaith conference, and there was a young boy there that came with his mother, and he was crying because he has become so fearful to go to school because the shooter drills that he has in school are scaring him. So we want to be able to look at what's happening with children. We have an increase in teen suicide across the country. We certainly have an increase in teen suicide in Georgia. It's 2% higher than it is in other states. And we're finding that there's a larger percentage of that that is related to firearms being part of teenage suicide.
Gotcha.
So we want to be able to look at all the aspects of gun violence and gun injury. And most particularly also, we don't address this in those categories. If we have a poison control committee and department at the CDC, so if you are poisoned, there is a place to go, and they gather statistics on people being poisoned and on children being poisoned. We have children in our state dying from gun violence. There's no department to go to gather those statistics. So for us, we think it is critical to be able to have the correct data before you can look at any strategies. We're not about taking away anybody's gun. The Second Amendment is the Second Amendment, and it's important to all of us. And if we start doing that with our amendments, it could have a very bad rebound effect for us. We want sensible gun owners to have their guns. What we don't want is when it becomes a violence, perpetuated injury or death. We want to be able to see how we can stop that.
Gotcha. Does ARC kind of distinguish suicide by firearm as part of the gun violence epidemic, or is that separate from the gun violence crisis, you would say?
No, I think it's all part
You think
of
it's all
the
part?
crisis. Yes.
Even so, what if someone might say, if someone might point out suicide rates in other countries that don't have gun control, how would you respond to that?
Well, I'm looking at suicide rates that are particularly related to using a firearm. But I think the easy accessibility of firearms in our households is an issue that we have to address.
Right.
Because you don't have to be certified in a safety program before you're allowed to bring your gun into your home. And unfortunately, it might not be the gun owner that was irresponsible, but there's a point of responsibility if you did not keep that gun locked up. And if somebody else, particularly a child, we hear this every day on the news where children were playing with a gun that was in the household. It went off and one of the children became either seriously injured or died. So we want to look at all of this when we're looking at gun violence in Georgia. We also want to look in the area of domestic violence. We know for a fact that guns are more rampant in domestic violence situations. And what can we do to address that? But I go back to the point of not just examining the data and getting the database so that we all have a better way of looking at what's really happening, that we can paint a landscape in Georgia. But I think it's also important that we consider that individually, what's our responsibility to keep our community safe? And if we're not addressing the violence, we can't have safe communities. So when you look at the CDC and how they study communicable diseases or the incidence of HIV, using that framework that they would use to study disease is the same framework we want them to use for gun violence. So within that is always going to be preventative measures. What incidents, what higher risks, and that's what we're looking at. What is the risk to certain communities? Is that a higher risk in this community that there'll be acts of gun violence than there might be in another community? So in a public health framework, you look at you do the research, you gather the data, but it's not just on people who have already been shot. It's on ways of preventing this, because you're seeing an incident rating that it could be more prevalent in this particular situation. So a public health framework will help us do that. That's why I feel that that is the way to go, and it's so important that we look at it through the eyes of public health. Because when you're looking at public health, you're not just looking at the individual, you're looking at how that affects all the other people in that community. And for us, that's why we're called the Georgia Coalition for Safe Communities. Safety is important. It's an inalienable right under our Georgia Constitution as well, that we should be allowed to be safe. And right now we're not. The children are not safe, the adults are not safe, our young adults and teens are not safe.
So, it seems that the ARC deals with basically any issue on public health that it can, and I'm sure, gun violence has been on your guys' list for a while to start and make some change. Was there a certain event that sparked you guys to really get out there and create the Georgia Coalition for Safe Communities? Or
I think, we have this coalition along with Faith in Public Health, Outcry, and Compassionate Atlanta. We are all three partners: Advocates for Responsible Care, Faith in Public Life, and Outcry, and Compassionate Atlanta. And I think for us, of course, the mass shootings that started to escalate were a problem, but for Advocates for Responsible Care, it was, again, we're not looking at what this is doing as a domino effect in our communities and in terms of the risks to public health. And Faith in Public Life also feels very strongly, and so does Compassionate Atlanta, that this is affecting not just that two people who were involved in an incident that might be gun related, but how does that spread out to the communities and everybody else that they interact with or that they come in contact with in the community. So law enforcement is very important. Our judicial system is very important. We're talking to leaders in all of these areas. As I said, the emergency room docs, very important, because our first responders are the first people that are handling these situations, and they're dealing with this every day, and they see the ramifications of one gun violence incident and how many people that can affect. So for us as a coalition, it was very important to put the public safety first and find ways that we could how could we really examine this that takes some of the hot button politics out of it and really looks at it in terms of the health of our community.
For a lot of these mass shootings that have occurred, for the majority of them, for the most part, they're typically younger people, in their early 20s. What is it about our current society that is targeting them specifically with these issues, and that's making them act on these violent behaviors, I guess, so to speak?
Yeah, well, that is one of the things that we want to see investigated. We want to be looking at what is troubling the youth so much that they feel their only outlet to be able to express what they're feeling inside, and it can't be verbally expressed, it's through this act of violence. And this particular act of violence, when you're talking about mass shootings, is not just injuring one person or five people. Now you're talking about a systemic effect of the violence. So I think that's the piece that's so compelling for all of us, because all of gun violence is not just a mental health issue, which I fear that we might be going in that direction as well too strongly. If we keep to a public health framework, we're going to be able to see all the nuances of this issue and really be able to determine when is it a mental health factor that should have been treated, or when is it a safety factor that there just were no safety precautions and responsibility. And the access issue. Too many people having access to guns without really understanding about guns and its effect.
No, that's totally fair. I mean, the accessibility is the concern of the other side. And so when you say you're concerned about the access, I would imagine the other side would say something like, but that's exactly why we're doing what we're doing insofar as, I guess, the gun rights advocacy. But I was curious as to a comment you made when you said you're hoping it would go less to this side. By this side, did you mean the mental health? And, why is that?
I don't want people just deciding that all people who create gun violence have mental health issues, because as a clinician that would be absurd for me to profess that. There are many more dimensions that you have to consider, and I don't want the labeling to occur. We had too much of that already. We're really concerned about the political environment of this issue, and we want to keep it strictly as a health concern.
Right.
Mental health is certainly an area that we need to be looking at more effectively and more often. But I don't want it to be labeled that all gun violence is happening from people
Right.
who have serious mental health disease.
So you feel right now the best way to go about it is to kind of stick with mental health and then move on to those other dimensions? Or
I think the best way is to look at public health.
public health, okay.
So looking at all those dimensions that I mentioned, because
Could you
when
mention some of those?
Yeah, when
Yeah.
you want to
Curious.
be able to get to the place of passing legislation, one of the main factors that we might not, those of us who are in grassroots advocacy, want to look at, but will move our political leaders, is what's the economic toll on Georgia of the gun violence and the escalation of gun violence. So we have to be able to look at that. Productivity, days lost, the strain of gun violence. Now you have victims. So now you're looking at a PTSD situation where there's a traumatic, long-lasting effect because of the violence that occurred.
You know, one reason I was excited to speak with you is because you do, you do go about, your organization goes about everything with the approach of mental health, and what's, public health. I think that's the first step in dealing with this issue in general. How, other than pushing for more gun research for Georgia, what other ways are you guys going about to get your voice out there?
The main thing that we would love to see is the Georgia legislators to agree to do a study committee based upon gun violence and its effects on the health and communities of Georgia. And I think that with that study, using a public health framework, we are going to be able to get information that we desperately need. And again, we're very much on having all the stakeholders at the table. So this would include educators, law enforcement, the faith-based community, other community leaders, our local elected officials, to me, are critical. We always start at the local level first because they are most vested in their own communities, and they know their communities very well. They know the people in their communities. They know the organizations in their communities and the faith-based community. So we're looking at engaging our local elected officials in this conversation as well, because they know best what their community needs.
I was going to say, why would it hurt maybe because a lot of, I would say, outside of local elected officials, and I think we just touched on this a little bit about politics, but it's sometimes a circus, and I feel like there's a little bit of an assumption when we say, like, oh yeah, they represent the people, because sometimes they don't, because not everyone necessarily votes. What about like a local survey? Because as we would know, Atlanta and then Georgia, very different.
Okay, one of the things that a public health framework will do is that it will zero in on those local communities that are most affected and highest at risk. The one thing that when we came together as the Georgia Coalition for Safe Communities, we also wanted to have the very difficult conversations surrounding gun violence. So we want to talk about what areas is this most affected by people of color. How are women most affected because of the domestic violence situation? How are children most affected in their schools? How are business people being affected by gun violence in their area? It's something that a lot of people don't think about, but I see this as a tremendous domino effect of all the stakeholders in a community coming together, because when there has been an act of violence like this, everyone has been touched by that. And one thing that the public health research will do is zero in on the communities that are at highest risk for gun violence, which I think is very important, starting there and examining what's exactly going on here in these households and in this community, and then we can make it a broader approach to all of the state. Because if your communities aren't healthy, your state isn't healthy.
I did want to ask then about, I would say, the invisible sort of kind of, because you said highest at risk, so almost lowest at risk insofar as like the visibility of a gun violence act, like a farmer, for example. He wouldn't be very visible because there wouldn't be any incidents, but I don't know, nearest, it's not hypothetical here, but nearest law enforcement officers miles away, people, you know, it's a different sort of situation. How will you take into account then the people who, it's just as important, I would say.
In the rural areas.
Yes.
Yeah.
That's, you know, Georgia, Atlanta.
Mm-hmm.
So we can't just, you know, I'm just
Right.
saying you have to.
So what happens in rural Georgia might be very different than what happens in the metro Atlanta area, for instance. So in that case, it's important that we hone in on what types of incidents are happening in rural Georgia that are different than the incidents that are happening in your metro areas. And examine that. Is accessibility greater in the rural area? Because it might be just part of their everyday life. But then how do they, you know, now we're getting into strategies that we can't really do until we have the data. But we have to consider everyone's approach to what does a gun mean to you.
Yeah, absolutely.
And that's going to be different in different parts of
For
Georgia.
sure.
Yeah, I was just asking because you said the first approach was the highest at risk, so I just didn't know if the, I guess, invisible occasions would be seen, I suppose.
Yes, because I'm also looking at, what about accidental death and injury from a gun? What if it wasn't an intentionally violent act? We still have to address that, and public health will address that.
Accidents, though? Like, 'cause there's car accidents. We have laws and measurements.
We have measurements for, that's my point. We have lots of measurements for car accidents, but
And
we don't have them in Georgia for gun accidents.
Okay.
Because
That's
many times
interesting.
that usually can involve a child.
Yeah. Okay.
Oftentimes it seems like.
Yes,
Yeah.
more often than not, if we believe our news, that it happens, and it does, and it involves children. So we have to look at that very differently than we would look at an intentional act of violence. But yet, we have to take precautions to protect the people,
Yes.
even in that situation. That's our job. The safety has to be for everyone, no matter what your zip code is.
Just in closing, you know, in our current political state, change can only occur so quickly. Is there a possible compromise immediately that can be made between the two sides of this issue to, you know, to appease them both?
We're hoping
currently?
that that's what the study committee would do.
Okay.
It will allow all the stakeholders to be at the table. It would definitely include both sides of this debate.
Kind of have an even bargaining table and all the information from the
Because
research.
once you
and then-
have all the information and you can identify the risk factors, then you can start talking about, so what are we going to do about this? And that's where then the strategies can come in.
Okay.
But I don't think that we could truly say, you know, there are other states that have wonderful programs. I'll just point out Massachusetts and New York. They have great programs that they have instituted to help reduce the effects of gun violence. But you can't say that any of those programs are going to work in Georgia. Even parts of them will work in Georgia until we have our own data that states what is happening in the Georgia communities. And that's going to help us then decide on what strategies are we willing to take on and try to implement to see if we can reduce the number of gun violence injuries and deaths in this state.
Mm-hmm. I think a lot of that, you know, dealing with, let's see, high capacity magazines and no background checks and stuff like that. Are you think with that?
Is that the Massachusetts
with that
and
information?
New York?
I'm sorry, not in New York. Just those are federal. With the or Georgia is definitely the background check. I think that's federal
Yes,
as
and
well.
we also have
No
red
background checks, but-
flag laws have been put on. They have been put on the floor last session.
Do you see really? I guess let's just say it. Do you see the right kind of, if when they get the proper information, do you think they'll take those proposals more seriously, or they?
Yeah, you know, I've been working under this dome for many
Right.
years as an advocate, just as a citizen advocate. That's what our organization is.
I heard you say a few times you're not a politician, and I knew when I contacted you that you weren't, but yeah.
Yeah. And I have to say that I am always hopeful, and I know that on both sides of our aisle here, we have very reasonable, sensible, concerned legislators. And I know that it will take time, but if you give them the information that they cannot dispute, that they will sit down and take this seriously, and they will want to do something, because Georgia doesn't like being last in attempting anything. And usually when it's the same thing for access to health care, it's always a matter of what's the information for us to first make some good decisions around. So I am always hopeful, and I know that we have enough legislators in this, under this dome, who really want to do something about the gun violence. And I know it's affecting all of them, because now is the time they're winding up their town hall meetings, because they're in their districts. And I know that they have heard from many, many mothers that they're very concerned about the gun violence in this state, because their children are scared and concerned. So I'm always hopeful that they are definitely going to come together. I have never seen that fail. Now, it might take a longer time than what most Georgia citizens would like to see happen, but I'd rather us take the time and have the right information to make the best strategies than to just say we passed a law that really then doesn't get implemented. That's my biggest concern. So I think if we can give all the stakeholders the right information by following through a study committee a public health framework on the seriousness and the risks of gun violence in Georgia, I know that our leaders will respond to that.
Awesome. Well, thank you so much, Dorothy. I don't have anything else for you.
Yes, you gave us a lot to think about.
Yeah, for sure.